Health officials in the region are engaging in a seminar on the island to brainstorm actions and plans to prevent and control non-communicable diseases, NCDs. NCDs account for 70 to 80% of deaths in the area and remain the largest global public health threat. In Saint Lucia, NCDs like heart disease, stroke, diabetes, and certain cancers lead to 8 out of 10 adult deaths. Jenny Daniel, the permanent secretary in the health ministry, outlined the lifestyle choices that contribute to NCDs in the region.
These include poor diets that are high in salt, sugar, and fats, a lack of physical activity, excessive alcohol consumption and tobacco use, obesity and overweight, urbanization and socioeconomic conditions. Also, cultural and social norms, and these norms include food-related traditions and social norms that often encourage overeating, unhealthy food choices, and unsafe practices. And I'm sure we can think of a number of those social norms and festive days, we call them, within our culture. In addition, a low level of awareness of the risks and prevention methods for NCDs is also a contributing factor.
The World Bank is assisting the region in facilitating the seminar to reduce the burden of NCDs. Alarming information from the World Bank indicates that 40% of NCD deaths in the region occur prematurely before the age of 40.
We're losing people in their most productive years. And in the World Bank, we're always encouraging countries and talking to them about the importance of investing in human capital. But as the pandemic has showed us, and as these figures show us, that all our investments in education can be lost in a second if people die prematurely from non-communicable diseases or are too ill to participate actively in the workforce. Another alarming figure to me is that since the turn of the millennium, in non-Latin countries in the region, we've seen a 38% increase in loss in disability-adjusted life years and healthy life years. So the problem is only getting worse. Countries in the region face a triple threat of diabetes, hypertension, cancer, and chronic diseases place an enormous strain not only on health systems, but also in families, in the economy.
Health Minister Moses Jean-Baptiste thanked the World Bank for supporting the improvement of health outcomes for citizens in the Caribbean.
We need to find not only multi-sectoral approaches, but we need to find ways to cause Caribbean culture over time to move towards better lifestyles and better health. Many times when I speak to individuals, whether it be in agriculture or health, I was a minister for agriculture some years ago, and we spoke a lot about how do we cause St. Lucians to eat better and to eat well and so on. And I've said many times the answer is really in culture. It's not only in technical papers and so on. So I'm hoping that over the next few days you can possibly have a discussion on culture. How do we cause Caribbean culture, St. Lucian culture, to integrate into this healthy eating and healthy lifestyle habits.
Data from the World Bank indicates that NCDs cost Caribbean countries between 1.4% and 8% of their GDP. Medical professionals in the Caribbean worry that high treatment costs associated with non-communicable diseases, lost productivity, and early deaths will result in economic losses that hinder countries' progress and economic development, ultimately leading to a reduced quality of life for their citizens. Healthcare officials are optimistic that they can formulate actions through the seminar to prevent and control the growing health crisis. Gina Filippi, HTS News Force.